said you think surgeries should be totally off the table for anybody under 18.
Trans women are not supposed to be denied entry because they have a competitive advantage over women in sports. They're supposed to be denied entry because they've got potential advantages that come from not being women. That's the issue.
Well, right.
Yeah,
I understand
but it's where the competitive advantage comes from, not just because they have a competitive advantage. Just because some women might have slightly higher testosterone doesn't mean her advantage is coming from being a male.
Listen. They're producing more androgens than your typical female.
That's fine. That still doesn't make them more men.
Right. Well, it technically does.
No,
if
it doesn't.
If you're producing more testosterone, you're more male.
No, that's not how male works. That's not how female works. No.
You are more. Yeah. So I just saw the discussion you had with Blair White, and I just wanted to bring up two things with you.
One of them
being the transport issue. I think for the most part we agree, but I just wanted to give you some ideas that might change your mind a little bit on the transports thing.
Okay.
And secondly, during that discussion you said you think surgeries should be totally off the table for anybody under 18.
Okay, yeah.
So, for the transports thing, obviously there is an issue with people who've gone through male puberty and have the, advantages that most men have of being taller, having more muscle mass, bone density, this and that. Now, women's sports is kind of particularly funny because in practically any sport, the more male you are, the more, say, fit for the sport you're probably going to be. So, if you're a woman and you just naturally produce more testosterone, and you're just more male, you're going to have more muscle mass, more bone density, shit like that. And actually, there are some weird genetic mutations where women can have really, really abnormally high testosterone, and they've actually, at one point, were banned from competing in the Olympics, and they only just recently overturned that rule. So you do have a population of, biological females that are extremely male, to the point where you probably would see roughly an even playing field between them and a trans woman who's, maybe spent year, 2, 3 years transitioning. When you're talking about fairness in women's sports, whether or not it's fair for trans women to compete, because, they, likely produce more testosterone, or they have some benefits of being exposed to testosterone for a while. If you're gonna say that's unfair, I don't see any really strong, logically consistent basis for which you can say it's unfair for women who just naturally produce more testosterone.
Sure. So this is a category error that I think a lot of people engage in, where they'll say something like, men versus women's sports are unfair because there's a wide variance of difference within those two categories of people. I wholly write that argument off as a category error. I think that while there might be variances within the groups that in some cases might even cause a significant overlap between other groups. So for instance, the strongest women could probably defeat the weakest men in sports, right? Or some women produce testosterone, blah, 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 sure, right? While that might be the case, the categories that we've decided are men and then women. Well, we've decided there's women's sports. We've made a protected class for women to compete in. So because we've decided that representation for women in society is important, and that women who want to aspire to athletes and whatever have kind of a protected space for that. Now that's women as a category. That's not all women. There are going to be some women that will never be competitive in sports. There are going to be most men who will never be competitive in sports. Right. But the variance within the class, I don't think, is justification for eliminating the classification entirely.
Well, I'm not saying eliminating the classification entirely, and let's just say hypothetically, I don't know, there's this mass amount of trans women who started getting interested in women's sports, you would probably see as a group them trending towards being better at sports than your average female, like cis female competitor. But the point I'm making is, like, if you're going to deny, say, a trans woman from competing because they have roughly, I don't know, 10% performance advantage over most other cis women in the sport.
Well,
you
hold on,
you are,
careful. No one is saying that. Trans women are not supposed to be denied entry because they have a competitive advantage over women in sports. They're supposed to be denied entry because they've got potential advantages that come from not being women. That's the issue.
Well, right.
Yeah.
I understand that.
But it's where the competitive advantage comes from, not just because they have a competitive advantage.
Well, right, but I mean, what's the difference between a trans woman, say, having that competitive advantage because they were exposed to testosterone for a prolonged period of time versus a cis woman who is also exposed to testosterone for a very prolonged period of time and currently is. They just, again, naturally produce more testosterone. So, like,
in sports for men, should men be able to dope if they've got, like, naturally lower testosterone compared to other men?
Like again, it's a nuanced issue, right?
Well, no. That's super clear, really easy question. If some man has testosterone that's lower than another man, should he be allowed to dope to be competitive?
Well, possibly.
No, come on. The answer is no. The answer is there's some variance within the category of men, and that's fine.
Wait.
What?
They do offer TRT exemptions for certain sports. There's certain boxing leagues. Let's see. They used to. Well,
I would be shocked if that was the case. Number one, but number two.
Well, wait, they do. Well, just look it up. TRT exemptions. In sport.
Even if there is a number. Even if there is a TRT exemption, my guess is going to be that this is going to be like a medically necessary for like ultra. Actually, I don't think this is fundamentally the same type of question that we're answering when it comes to trans women.
The point I'm trying to make. The point I'm just trying to make very simply is that. When you're talking about denying trans women to the ability to compete, but you're accepting these very exceptional women who have a weird genetic mutation where they overproduce testosterone, the only argument I could see is that, well, a cis woman just has a birthright to compete, whereas the trans person doesn't.
The cis woman does have a birthright to compete in women's sports because they're born as a woman, yeah.
Yeah, so, like again, it's just a little bit of a funny position.
It's not funny. It's wholly and completely consistent. I think that the position that you're trying to take, where you start to draw lines between like the amount of testosterone, those positions break down almost immediately. You can either defend women's sports on the ontological categories of what we decide men and women are, or you can get into really weird areas of like, well, where are we precisely going to draw the biological boundaries at? Those arguments are untenable and goofy.
Well, look, I know there is a need to protect women's sports. I'm just saying I think there's a little bit more nuanced when you're looking at some trans women who are competing who might be a bit above average, but are within sort of what you'd expect from high-level athletes.
Well, yeah, but even if they're a bit above average, the fact that they're gaining that bit above average from a male physiology is what kind of defeats the whole purpose
Other cis women are. Who is the trans NCAA swimmer?
Leah Thomas?
Yeah, Leah Thomas. Look up all of the top times in the women's
Wait, I don't need to look at the top
NCAA.
times. Just because some woman might have slightly higher testosterone doesn't mean her advantage is coming from being male.
Listen. So if you look at the women who have the top times in the NCAA, they look very fucking similar to Leah Thomas.
Yeah,
and
but they're not
men. Yeah, I know, but the reason they have some of those physical qualities is, again, because they're producing more androgens than your typical female.
That's fine. That still doesn't make them more men.
Right. Well, technically does.
No,
if you're
it doesn't.
Producing more testosterone, you're more male.
No, that's not how male works. That's not how female works. No.
You are more. Okay, so wait. You're telling me if a trans woman is transitioning, a man transitioning into a woman, they start taking hormones so that they stop producing testosterone, and they start producing more estrogen. You're saying it doesn't change whether they're more male or more female?
No, I would say the gender expression is changing. I don't think I would say that they become like biologically male or biologically female. No.
Well, I'm not saying they become biologically.
I don't think they biologically become
It's,
more male or more female. It seems weird to look at this as like a bimodal thing rather than like a binary thing. I view sex as being binary, but
there is an aspect of bimodality here. Again,
there's bimodality in the traits. So if you want, you could say that a woman that produces higher testosterone is more masculine. I would probably agree with that, but I don't think I would say she's more male. No.
Well, yeah, I guess you could use that wording.
Well, sure, but again, I think these imply two very different types of arguments, though. Right? Like, I could wear clothes that make me more feminine or clothes that make me more masculine, but it doesn't make me more male or more female.
Well, we're talking about traits that affect sports performance, right? So, like, in theory, you would not have a problem with trans women competing if, on average, they had no performance advantage, right?
If on average, the problem is there's a big intuition pump there. If trans women on average had no performance gains over cis women, I probably wouldn't have a problem with it. However, this implies that men have no performance advantage over women, which is why the fuck do women's sports even exist?
Well, it doesn't.
What? Well, no,
it wouldn't imply that.
Well, no, I'm just saying. Well, because
that,
the only reason I'm saying it implies that is because the advantages that trans women enjoy over cis women come from their male biology, and the reason why female sports exist versus open sports is because of the differences in biology. That's why I'm saying it implies it.
Well, I'd say it doesn't. The only thing it implies is that post-transition there may not be any substantive differences, and there are some sports where that's the case. Given
there might, I know, like in
enough
trap
period.
shooting, I think like women are more successful than men.
It's not just that. In long distance sports,
yes, and in distance running, I've heard that one, but I've looked up times before, and I don't believe that's true. But sure, there might be like two. I think in power walking, I think they have an advantage. There's like two sports where maybe, but like for by and large, 99% of sports, generally, like you said, the more male or masculine you are, generally the better time you have in competing.
Right, but what I'm saying here is there are exceptional female athletes in whatever sport you want to name, swimming, weightlifting, what have you. The reason why one of the reasons at least, they're so successful in these sports is because they are more masculine, they do produce more testosterone. If that's the reason why they have an advantage over other women, why is it an issue for other trans women to compete? And like, again, it seems to me like you just say, well, they have a birthright.
I feel like we're back to the argument where you're essentially saying that like, because there's large variances within the category itself is meaningless. Like, yeah, some women might have big advantages.
I'm not saying the category is meaningless.
Yeah, but you're saying because they have, just because they have more testosterone than other women doesn't mean that we let people that are biologically male compete. Like, for instance, let's say you had, like, I wouldn't agree. There might be some men that have incredibly abnormally low, below 100, whatever, testosterone.
Sure.
Like, do we let them compete with women? No.
Like, in theory.
No, not even in theory.
Well, no. Like, in theory, if we're going to be, like, if we're going to maximize fairness in sport, I don't see why there'd be a problem with a male competing with a female if, again, on every performance metric, they're equated. But I think we have common ground here. Like, what we do agree on is, like, yeah, there should be categories in sport. And I do think there should be some amount of restriction on trans women from competing. I think some of the worry, though, on trans women competing is a bit overblown because female sports as a category is a little funny, and cis women are going to be at an advantage if they are more masculine, produce more testosterone. And there are some trans women who are going to be at an advantage for the same reason. So, like, if we're going to have this sort of viewpoint where trans women can't compete because they're more masculine, and those masculine traits give them an advantage, you're really down to just saying, well, you can't compete because you don't have the birthright of competing.
Yeah, I'm okay with that birthright thing.
Okay.
Because no. Also, and then here's a question that I always ask for people. Are you okay if we draw these exceptions for trans women? Are you okay with the fact that trans men will never be competitive in sports ever?
What do you mean?
Like, if you've gone through puberty as a woman, the likelihood of you being competitive in any male-dominated sport is probably close to zero. Like, is there a single trans man? Like, so if we draw these category exceptions, and
there is one male trans. Well, yeah, there is one trans male athlete that I believe competes in professional boxing. I don't think they're amateur. I'm pretty sure they're in a professional league.
Okay, maybe there might be
there's one. Yeah.
Somebody in chat just said he wrestles with women. I don't know if that's true or not. I'd be curious to see who it is. But I'm saying that, like, by and large, like, trans men will essentially never be competitive. But they're
gonna have it's Patricio Manuel. That's his name.
Okay, so then how do you square this? Because now it seems like you're basically saying that, like, well, trans men are just fucked, but at least trans women can compete, no?
Well, the reason they have an issue competing is because, again, they have a physical disadvantage.
Yeah, but then the reason why trans women would be successful is because they have a physical advantage. But these advantages and disadvantages come from their sex at birth, right?
Right, but again, the advantages that cis women have come down to, again, like, who their parents are. Like, it's
that's everything. You're doing it within category
difference.
again. Yeah, that's true of IQ. That's true of, like, muscle mass. That's true of, like, zip code, finance. Like, sure, but I mean, we've decided that, like, there's women's sports. There's going to be variance within the category of women's sports, but that all women are.
Well, look, again, I think we both agree that women's sports does need to be a protected category. The only thing I'm pointing out here is that people are absolutely freaking out that, oh my god, like, trans women are going to absolutely, like, dominate women's sports, when, for one thing, there's practically zero. Leah Thomas was, I think, the only NCAA trans athlete ever. And then there was Laura Hubbard, who bombed out of the Olympics, which may have been intentional, who knows. But
I understand. I agree with you. Oh god.
Well, listen. These people weren't even at the top of their sport to begin with, and, like, if you look at cis women who are competing at the top of their sports, like, you can just look it up. Look at Leah Thomas and look at the other top swimmers in the NCAA. They don't even look different. Honestly, like, some of these women have more muscle mass and are about the same height as Leah Thomas. So I think it's a little transphobic to go too far in the other direction, where it's like, okay, never under any circumstances should, like, a trans person be allowed to compete because, like, just on the basis of being male, you're automatically going to have an advantage, when it's not necessarily really the case. I think given an adequate amount of transitioning, like, and depending on the trans athlete, like, I do think if somebody like me were to, like, compete in women's powerlifting and transition, that might be a little ridiculous, because, like, I'm 6'3", I'm fucking almost 300 pounds and shit. But when you're talking about other sports, like, you know, Leah Thomas, when you can find very similar looking and actually better athletes that are cis female, I think the concern is just overblown. That's the only point I'm trying to make.
Sure, I can understand feeling like the concern is overblown, but I think the scary thing, and I think we probably have seen enough at this point to establish a trend, the scary thing is that if we move too far in the pro-trans direction, it's probably never getting reversed. Like, so that's probably what people are scared of, is if you give an inch. Like, because it's not like if we let trans people in, let's say we let trans people in, and then in 5 years, all of a sudden, like, they're destroying like, all the athletic events, are people gonna be like, okay, time to take them out, this didn't work? Like, that's probably not gonna happen. And for an interesting case study that nobody wants to talk about because it's incredibly awkward, and I'm sympathetic to the awkwardness, this has technically already happened in esports. Nobody really said anything about it because, again, it's awkward, but at least back in my day when I was competitive, I don't know if it's still that way, you had a lot of, like, the first woman ever to be competitive, the first woman to be on teams, the first woman blah blah blah. All of these women were trans women.
Yeah.
So then you run into a weird area where it's like, okay, well, we've got good female representation on stage. Like, women are finally competitive in esports, but every single one of these women is a trans woman. And now what, right? You're never going to take it back. You're never like, oh, yeah, hold on. We changed our mind. This person doesn't count. We're going to make a different women's category. Because now, now you're, like you said, you're transphobic. So,
well, there are probably two main reasons for why you're seeing a high amount of trans women in esports. For one thing, they did grow up male. These are male-dominant hobbies, so they'd likely take over their hobbies from things they're exposed to from being male. Secondly, there are other benefits to testosterone aside from just like muscle mass. It does make you more competitive. It does improve things like fine motor skills, so that would also probably give them an advantage. Do you think there should be a separate category in esports for women only?
I think for a little bit, I think it's okay, but my personal feeling is that almost all of the difference between men and women in esports and video games probably comes down to socialization. I think socialization has huge impacts on hobbies. My evidence for that is I just look at like the world of music, like men and women play very, very, very different instruments, but I don't see any biological reason why. Like, men all play like guitars and drums and all that shit, and it's just like ubiquitous that if you're in rock bands, that's all men, but women can play like viola, violin, piano at godlike speed. So I don't know why women can do that, but they can't do guitar. That doesn't make sense. So my guess would be that for like fine motor skill stuff, a lot of that is probably socialization. But like, the socialization is an important aspect. So I mean, if you want to make women's leagues to encourage women to play games and shit, I don't think there's anything necessarily wrong with that.
Yeah. Okay. Well, the other thing was your take on completely, I don't know, banning, or I don't know if you were in favor of banning. I'm not sure if you mentioned specifically, but you said it's wrong for somebody under 18 to get like a double mastectomy.
Yeah, I don't know if I'm fully on board right now, just because of where the research is at. In terms of like trans surgeries for minors, that seems to be pretty extreme.
Okay, do you think it's extreme for a 15-year-old boy with severe gynecomastia, where they actually have very enlarged breast tissue, to get surgery to get it removed?
No.
Okay, so then why would it be a problem in the trans case?
Because I don't think there will ever be a history of a man being like, fuck, I miss my gynecomastia. Why did I get my fucking tits removed?
There are, in fact, straight identifying men who decide to get breasts.
Okay, well, I guess I can't speak to their experiences then. I don't know. Well, I don't know what I'm supposed to say.
Well, like, let me give you this hypothetical.
Okay.
Maybe in the future, this person with gynecomastia is, I don't know, like, wants to be a femboy in the future, or wants to cross-dress, and having that, like, extra breast tissue makes them a bit more convincing when they cross-dress. So should they wait until they're 18 to perform the gynecomastia surgery?
No, I don't think so. I think if they want to get fake boobs in the future, they can go for it, I guess.
Well, again, like the point is, it's gender-affirming care. That's exactly what it is.
Well,
so if you're gonna, it is gender-affirming care.
There's kind of a.
Why do you think anybody would want to get their gynecomastia removed? Especially if it's not like very hard, and like when they lie down in certain positions, it hurts. Like nothing like that.
Yeah,
if it's just like large or soft tissue, then what do you think the reason for getting rid of that is? It's gender-affirming care.
Yeah, there's a word trick that's being played here when we say gender-affirming care. Usually when we talk about gender-affirming care, the implication is somebody is transitioning from one gender to another. And then to say that like somebody getting something that's done in line with their gender at birth, to call that gender-affirming care is a bit of a word trick that I don't think most people would agree with. The gender-affirming care that a woman gets when she gets a breast augmentation because she had a double mastectomy due to breast cancer is a lot different than the quote-unquote gender-affirming care that a trans woman gets if she gets breasts because she wants to feel more like a woman. I think those are meaningfully different things. If you want to call them both gender-affirming care, you can, but I think that there needs to be another differentiator in there because obviously these are two different types of things.
In the case of gynecomastia removal, I don't see a difference. Like,
you're having a born as a man getting a surgery so that he can continue to feel like a man. Yeah, but it's man to man, like gender affirming. It's not like
right.
Yeah,
right.
but it's man to man. It's not like you're changing the gender, which is, I think, the general implication of gender affirming care.
No. Well, that's what most of it is, but I don't see like a meaningful difference between a man getting surgery to confirm their gender, so including gynecomastia removal, versus somebody who's biologically female getting surgery to confirm, their male gender.
Do you think if somebody has low muscle mass, do you think that them like roiding up, would you consider that like gender affirming care?
Yeah. At least in a lot of circumstances. There certainly are like a ton of young kids who are going on steroids because they don't feel manly enough. They see like Chris Hemsworth and shit, and they think like, oh crap, I'm skinny and weak and pussy or something, and then they go on steroids. I would consider that. Again, taking like steroids or getting some sort of treatment in the interest of affirming one's gender.
Okay, do you think that like, okay, so then you would argue that like a 15-year-old should be able to get like breast surgery to feel more like a woman?
Yes, if it is determined by, a medical team, including, doctor, general practitioner, surgeon.
Yeah, sure. Do you think that a 15-year-old
sure,
cis woman should be able to get breast augmentation if she feels like her tits are too small?
Oh, like enlargement?
Yeah.
I don't think so. The reason being is I don't really see that being enough of a psychological issue where the potential risks of performing the procedure outweigh the potential positives.
Is breast augmentation a risky procedure, or I don't know? I'm generally asking. I know like BBLs are really risky. I don't know if breast augmentation is.
Well, yeah, BBLs are insane, but
I don't know how you can defend, like, I guess I don't know how you can defend breast augmentation, or not breast augmentation for. Here, this is a very weird hypothetical, I guess.
By the way, I do believe there are actually cases of minors getting breast augmentation or some sort of surgery to correct chest deformities because they have like a severe chest deformity.
Well, no. Chest deformity this is different, right? Because I'm going to agree with you for correcting deformities. That's why I think gynecomastia is okay.
Well, what I'm pointing out is like there are women with Crowder had it. It's like this cave-in in your chest, and I know there are women who are minors who have gotten breast augmentation to kind of hide that and have a more like, pleasing looking chest.
Okay, I guess it's possible. Okay.
Like, as like I have also seen rhinoplasties in pretty young kids. I think there was like a 15 or 16-year-old kid. It made the news, and she had like a really crazy fucking Pinocchio nose, and she was getting bullied and shit. And then they got her rhinoplasty. I'd err kind of on the side of that being appropriate, given the way her nose looked and how severely bullied she was getting.
Well, okay, wait. I'm sorry. Hold on, wait. Are we talking about? Did she have like problems breathing, or you're saying just because the way her?
No, it was entirely just because of the way her nose looked.
So you'd be okay greenlighting basically any type of cosmetic surgery. If a woman had an especially flat ass, could we greenlight like BBLs for teenagers or
for a minor?
Yeah.
Well, again, like this is a sort of risk-benefit assessment that needs to be discussed with a doctor. And I don't think any doctor would greenlight something like a BBL for a 15-year-old because of so many different factors. For one thing, massively increases the risk of heart attack and stroke. Secondly, this is something that could possibly be corrected without surgery. Just getting older and more mature might make your butt grow because you're going through puberty. Weight training might also make your butt grow. Just gaining weight might make your butt grow. So when a surgeon's looking at this and they're seeing like the whatever psychological issues a woman or man might have because they have a small butt, and seeing the list of treatment options on the table, they'd probably say no. But when you're talking about getting a double mastectomy for somebody who has severe gender dysphoria and they're thinking about killing themselves, like I don't know why you would say like, oh yeah, like surgery should be completely off the table for somebody like this, when you can when you'd be fine with a 15-year-old kid getting their breast tissue removed because they feel like it's embarrassing to them and they feel less of a man because they have, you know, that breast tissue. So
I think the issue is because that's so far outside of the normal, ordinary, healthy development of a male body that literally makes you look like a female.
Common.
It is
incredibly common.
What do you mean? What does incredibly common mean?
Gynecomastia is extremely common. It affects, like, I think around 10% of young men. It's extremely common.
Hold on. Is this
usually it goes away on its own.
Is this gynecomastia? Sorry, go ahead.
Yeah, gynecomastia usually either goes away on its own, where the breast tissue shrinks, or it's not that bad. A lot of people are at a body weight where they might not notice it. Sometimes you have to be fairly lean to notice that you have gynecomastia. But it's extremely common. About one in every 10.
Yes. So we're playing word games again, okay? When we're talking about gynecomastia, I'm talking about pathological gynecomastia, not like your breast tissue swells a little bit during puberty. Obviously, I would never be okay with somebody getting a surgery during puberty when somebody's breast tissue might be swollen a little bit because our bodies look weird during puberty. But like if it's just something that just goes away on your own as you age, I don't know if I would consider that like pathological gynecomastia. Like, I think I would use a different word for it. They might be considered medically gynecomastia, but it's clearly a fundamentally different thing than...
Well, gynecomastia is gynecomastia. Whether it needs surgery to be corrected, again, is a discussion that you're going to have with a doctor. So if it bothers you personally, and you have other maybe social issues where if you, I don't know, go to your school and you have to take your shirt off in the like change room and everybody's making fun of you, and you're thinking of like killing yourself and shit, or like skipping school because of it, like again, this is a conversation that a doctor might have and say, okay, yeah, like it's severe enough and you're having enough psychological issues with this problem where we'll greenlight the surgery. If it's a very minor amount where you see just a little kind of like protrusion under the nipple and you can only really see it in the right lighting, and like the doctor asks, okay, are you getting made fun of? Like, does anybody notice or comment on it? And they say no. And like the only thing they're doing is just obsessively looking in the mirror. Okay, then like the doctor will probably say, you know what?
But then, so at this point, then we
look.
essentially created a society where every time a teenager is uncomfortable enough with their appearance that they want to kill themselves, that now we're just surgerying every single kid that has issues. Because then every girl is going to be getting rhinoplasty. People are going to start getting breast augmentation.
No.
Every guy is going to be on steroids. I mean, that's a society you're creating. Like, he wants to kill himself because he's got a little bit of pubescent gynecomastia. That's insane. The problem there is mental, not physical.
Did you listen to anything I said?
Yeah.
Okay, so
if you'd like, I can restate some part of it if you feel like I...
Destiny, there are no laws prohibiting minors from getting plastic surgery.
We're not talking about the legality right now. We're talking about the ethics.
So what are you talking about? There's going to be this rush of kids getting rhinoplasties or breast augmentation.
Because
There's no laws preventing it, and it's already happened.
Because you're elevating this from a cosmetic surgery to like an elective like medical procedure.
No. What? Do you know what elective means?
Yeah, it's a procedure that you're choosing to have done, but you're doing it for medical reasons.
Right, but I don't understand how it's not a medical reason in the case of gender dysphoria.
Well, because hold on, you're not talking about gender dysphoria. You're broadening it to now people that just don't like their aesthetic, and then they say they're suicidal.
What I'm saying is you see very similar symptoms of gender dysphoria in cis people who have female or male traits while they're a male or a female. Traits opposite their biological sex that they're extremely uncomfortable with.
I think creates
psychological and social problems.
I think
so. Why, in the case of the 15-year-old boy, is it okay for him to get his breast removed, but in the case of somebody suffering from severe gender dysphoria, no, under no circumstances can you get it. I
wouldn't say it's okay for the 15-year-old boy. Okay, I didn't know that you were going to refer to just like some pubescent gynecomastia that's slight and disappears after a while. I thought you were talking about the full-blown pathological gynecomastia.
Well, again, there are different levels of severity with gynecomastia, and just like with gender dysphoria, this is a conversation that you're gonna have with your doctor. Where if the gynecomastia is minor, it's probably going to go away on its own, and nobody even really notices it that much. Then the doctor's
Well, no,
gonna
you're
say,
saying that it's like
no,
minor and
you
it's going to go
probably
away.
shouldn't have surgery.
One of these is like a medical condition that's due to elevated levels of estrogen or androgen insensitivity. The other one is just like relatively normal development through puberty. Like these are two different things.
Okay, maybe you should look up the definition of what gynecomastia is.
I
All
did
it
look up the
is
definition. So
enlarged-
the etiology of gynecomastia remains unclear. Most cases of gynecomastia are thought to result from the imbalance between estrogen and androgen. However, in pubertal gynecomastia, the majority of adolescents have normal estrogen levels, although several studies have demonstrated elevated levels in some patients. Pubertal gynecomastia is thought to be a physiological phenomenon and is most commonly seen in mid-puberty with Tanner stage 3 to 4 pubic hair and testicular volumes of 5 to 10, blah, 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 blah. In a 3-year longitudinal study of hormonal changes during puberty, study participants with and without gynecomastia were compared. No association was found with race, and no significant difference was found in serum
What does this
estradiol.
have to do with
Hold on, I'm
anything
getting
you're
it. Give me
saying?
one more paragraph, okay? Pathological gynecomastia is rare in adolescents and pubertal aged boys. It is related to conditions where absolute or relative estrogen excess is present, with either 1, exogenous intake, meaning you're injecting yourself or doing something, 2, with endogenous production, or 3, with increased peripheral conversion of androgens to estrogen secondary to abundant aromatase activity, androgen deficiency, or androgen insensitivity. So pathological gynecomastia is not the same thing as sometimes guys get like booby tissue when they're going through puberty. These are two fundamentally different things.
So, Destiny, like what I've been telling you this entire time is it's f***ing ridiculous to have this position where under no circumstances can a minor have surgery. There are circumstances.
I never
where it's
said under
appropriate for a
no
minor to have
circumstances.
surgery. Well, you did say that during the Blair White.
I think that
Interview.
no, because everybody that was listening to that conversation knows that we were talking about like the context of like sex reassignment surgery and stuff. Not like
well,
a girl has a really
that is already
big.
banned for minors. You cannot get bottom surgery if you're under 18.
Okay, I would be opposed to top surgery as well.
Okay, but you're not opposed to top surgery for cis.
I don't
people.
consider that top surgery. No.
Well, that is.
Okay.
It's the same thing. Removal of breast tissue.
Okay.
Can you give me a reason why it's okay for like a 15-year-old boy to get his breast tissue removed if it's extremely enlarged? But
Yeah,
it's not
because
okay?
there's a pathological abnormal development in the body that is abnormal to what the ordinary development of a male would be.
Okay, and there's an abnormal development in a trans person where they're really uncomfortable with their breasts.
Sure, but we don't have an easy.
not-
We don't have a 100% way. We don't even have a 50% way. We don't have a good way of identifying those people yet.
Yeah, we do.
Okay.
Like, can you show me the rates of like people who really regret these sorts of procedures? Like when you have a kid who knows they're gender dysphoric, you can ascertain that with an extremely high degree of certainty. They always wrap their chest whenever they can, cut their hair short. They're into boy stuff. They tell you they like constantly have this like fucking horrible feeling where they need to get their breast removed because like it feels so bad. Like all the fucking signs are there. Why would you deny them a procedure that could be life-saving if their gender dysphoria is so bad that it's making them suicidal?
Because as long as they've started hormones, they can probably wait until they're at least 18. That's probably the more important thing. Things like puberty blockers, rather than having to get fucking top surgery before you're 18. I don't think that's as essential. And I don't believe we've got good ways of identifying people that are truly gender dysphoric yet. That doesn't seem to be the case.
Okay, so same thing with a 15-year-old. Like, okay, well, you've been living with it for this long, so I guess you can wait till you're 18.
No, I don't consider like the abnormal, like very clear, like we haven't made mistakes where it's like, oh my God, that guy didn't have gynecomastia. Like the big boobs were an illusion. Like that type of physical treatment is a lot different than like trying to identify a psychological problem. So
Okay,
for instance,
so
right now,
what
we give
degree-
SSRIs to children, right? And we give ADHD medication to children. I'd be okay with that. I wouldn't be okay with like a surgery to remove depression, like remove a part of your brain that gives you depression for a minor. I wouldn't be okay with a surgery to remove a part of your brain that fixes ADHD, but I'm okay with the pills. Same thing with hormone treatment. I'm okay if people want to delay puberty or even prevent puberty. I guess if they make that decision ultimately, that's fine. But the surgeries, I think, elevated to another level where the reversal is very, very, very difficult. And if we can't identify this with a high degree of accuracy yet, we probably shouldn't be giving permanent surgeries to people.
Okay, what degree of accuracy do you need?
I don't know, whatever is the standard medically accepted degree of accuracy for error rates and medical treatments. I don't know what they are right now. I imagine it's probably less than 1%.
Okay, you can find many different procedures where there's way higher than a 1% rate of regret.
For children that aren't medically necessary?
I don't know about in children, but for adults who can make
we're not
an informed
talking about
decision,
adults. That's different. For adults,
Yeah,
adults
I
I think have a much wider difference to choose what they want to do.
Yeah, well, the thing is, you can find many operations, including cosmetic surgeries, where there's a much higher than 1% regret rate.
Sure, that's probably true. But again, if you're an adult, then you have the ability to make that decision, right? That's what informed consent means. Right.
So you're saying with a child getting surgery, there needs to be less than a 1% regret rate?
I don't, you're trying to nail me 1%. It's whatever the acceptable fail rate is of like surgeries for. I don't know what that acceptable rate is. My guess is it's probably around or less than
50%.
I seriously doubt that is the case.
You'd be okay with 50%?
I don't think 50% is the accepted thing.
Okay, well, what if it was?
If it was, then yeah, sure. If that's what we graded everything else on, then sure.
Okay, what if it was 99%? You'd be okay with that then?
I'd probably be talking a lot about how I disagree with how modern medicine is practiced if a 99% error rate is what we accepted.
Then this has nothing to do with, like medical standards. Then this is just like your own opinion.
Wait, no, hold on. My opinion is that I trust what the medical standards are because there's an entire apparatus set to determine what is a decent risk. Okay. And I trust medical and scientific communities to evaluate that risk.
The medical standard currently is allowing trans kids with enough, like a high degree of certainty, to get double mastectomies. So how could you say that?
Because I disagree with the evidence that's present for that. Disagreeing with the evidence that's present isn't disagreeing with the standards. Just because I disagree that there's enough evidence for an available thing doesn't mean I'm going to throw out every single thing in the medical community. Like, why do you take vaccines?
You just said you would agree with the medical standards, and the medical standards are allow mastectomies.
I said the general medical standards for whatever a fail rate is on a particular drug.
Okay, do you think that there may be different rates of, I don't know, regret over certain procedure or different rates of success for different procedures that are, like, acceptable? I don't know why you'd have to have
might be,
one
sure.
single... Right, so I don't know how you'd have, like, one single epistemic standard when it comes to any drug or treatment.
Because you're trying to push me on an exact number, and I don't know what the exact number. My guess is my number would probably be around 1%. That'd be my guess for a surgery that life altering. 1 out of 100 kids get their lives fucked if they or it might be, or even it might be a comparison if you show me studies where it's like, let's say that of 100 kids that really want breast surgery, if 4 of them don't get it, they kill themselves, right? In that case, I'd say, okay, well, fuck it. I guess an error rate of 4 or less is probably okay, 4% or less, because if 3 kids ruined their lives doing a breast surgery, at least 4 kids didn't kill themselves. Maybe it'd be a comparison there. I don't know what the exact number would be though. You're not winning this argument because I can't give you the exact number that I would accept for a fail rate here. Like, you're not changing my mind or anybody else's on this.
I just want to know your standards so that I can get some evidence or look at some, numbers.
Sure, the evidence would be right now. Yeah, the evidence is not in existence right now. It's we have very, very, very scant evidence on children related to the trans procedures. I mean, countries will continue to research and study them, and then as the studies come out and as we develop better therapies, there's probably a world. For instance, if you could identify trans kids 100%, I'd probably be okay with bottom and top surgery for trans kids. If you knew or not 100%, but if you knew like 95%, I'd probably okay, fuck it, go for it. If they want to do it, the parents are okay with it, then go for it. But right now, it doesn't seem like we're at that point. The research is not there yet.
You do realize, like last point, you do realize with gynecomastia removal, there are people who regret the procedure to some extent where they're not happy with the outcome. So, again, in the case of like a 15-year-old, they may only have access to a certain surgeon who's not particularly good at it, and they might have like permanent scarring that looks weird, or their nipples may cave in to a significant degree, and they're not happy with the results. Do you think again that because there's maybe perhaps over 1%?
What's the unhappiness rate or the regret rate of that surgery?
I'm not entirely sure, but again, I wouldn't be surprised if, like, there's some, like, again, it's hard to say because you may have a surgery that you're not happy with the outcome, but you are happier than not getting the surgery. Like, what I'm just saying is, I'm sure you'll find quite a few people not being perfectly happy with the outcome. So,
okay, but I mean, like,
do you think,
if the rates were high enough for adults that they weren't happy, that wouldn't change my mind for adults. If the rates were high enough that children weren't happy, then I don't know. I'd have to compare them, I guess, to other rates of what do we consider acceptable surgical standards in the United States. I'm not sure. And then I probably have to compare outcomes between both groups.
Okay. Well, I'll look up some of this stuff and see what I can find.
Okay, have fun.
And then maybe I'll talk to you again.
Bye.
All right, take care.
Jesus Christ. Where the fuck is sturdy at? I feel like it's... Is it way back here? Oh, jeez.